I have a patient coming in today with a pretty interesting case. So this is a patient who actually had a complete nail avulsion performed in the past and had a matrixectomy, which is where the root is burned so that a nail doesn't grow back. And not uncommon, there are times where a portion of the nail does come back, and that's exactly what we see here. This procedure was done back in 2000, and now we see that there is a portion of the nail that is still growing. So what we're going to do today is remove the remaining portion of the nail and actually do another matrixectomy so that that portion doesn't grow back. So patient's already been numbed. We've put on our tourniquet so that we can minimize the bleeding at the procedure site, so it makes it nice and clean for us. So first thing we do, make sure the patient is numb. Any pain there?
Not a damn thing.
Okay, so you heard it there, no pain. So we're gonna work our way around this little spicule of nail that was stubborn and grew back. So we just find the ledge that allows us to kind of advance the instrument down in and around the remaining portion of the nail. So we're just going in and around. Once the nail is loose, you can see it just lifts right up. So now that we have that nail out, we'll come in with a hemostat, clamp it down, and remove it. Make sure everything looks nice and clean, which it does. So I'm happy with that, and you can see what came out was a pretty big piece of nail that was left over. So now we're ready to do our matrixectomy, and this is a part where we apply a chemical solution, which is phenol, and what that's going to do, it's going to cauterize, chemical cautery of the germinal matrix, which is what produces the nail. So the standard here is 3 applications, 30 seconds a piece. So we go in and we are just going in and around where that nail was removed, making sure that we are looking to see that we're getting all the areas that are exposed tissue so that we can prevent this from happening again. So we're just looking at the clock, making sure we got 30 seconds, going in and around, making sure we've got the border where the skin was growing. So we got 1 application. Feeling good so far?
I'm doing damn good, Doc.
Good.
I could go to sleep.
Good. All right. So you can see that cotton tip applicator goes down a good amount, and that's where the matrix actually lies. So if I were to point it out with my finger, that's a good, 3 or 4 millimeters down. So you have to make sure that you're advancing your cotton tip applicator all the way down and feeling that resistance. If you just kind of leave it where the nail was visual, you're not going to get it all, and that's what happens sometimes. Sometimes you just cauterize the area where the nail was on the nail bed, but not the matrix itself. So we want to make sure we're all the way down. So that was our second application, and last application, 30 seconds, in and around. Good, good, good. And that's it. Now we use some rubbing alcohol spray to just wash out any of that remaining phenol. We don't want it to stay in there and keep working. We've done our 3 applications and that's it. So once that's washed out, we take one last look, make sure we like what we see, which I do, and that's it, all done.